Okay, so nice to meet you guys. My name is Julia Netto. I'm the founder of Hermave Wellness. It is a prenatal and postpartum specific fitness company. And I have been doing this work for about 10 years as a private personal trainer in New York City. I do virtual training. And then I also have developed an online workout program specifically for every week of pregnancy and postpartum recovery. And I've done, as you can see here, a lot of different certifications specified to pregnancy and postpartum. And over the years, I've really just learned that, we can't just treat women's bodies during this time like any other time. There's so much change that goes on, and there's so much shifting to our anatomy and how our muscles function, how our body works, our nervous system, our biology, everything, as I'm sure you guys have experienced. And it really takes a lot of more careful consideration to not only keep you feeling good and moving well, but also to prevent different injuries or dysfunctions, which we'll kind of touch on today. So yeah, this is my passion. I'm really excited to share it with you guys, and especially for postpartum moms. I love working with pregnancy, but I feel like postpartum is a time where we really need that attention even a little bit more, because it's really hard to set aside the time to care for yourself during that phase, right? So I'm glad you're here taking the time, whether you just had your baby or when it's been a long time and you haven't had time to get to this. I'm happy you're here now and going to spend some time learning about how to heal your body better. So before we start, I just want to know if you guys have anything specific that you've experienced that kind of brought you here today, because the event's kind of about rebuilding your core, and I was reaching out specifically to people who felt like maybe things had shifted and they just weren't feeling the same. And there's so many different ways that that can manifest, because it really depends on your pregnancy experience, your birth experience, your delivery, and how all of that went. So if anybody is open to sharing just kind of what their body has felt like lately, whether you felt any heaviness or any bulging or any difficulty engaging, no worries if you don't feel like sharing. But if you want to, let me know in the chat how your body has been feeling. It'll help me help you guys a little more. But I'll just tell you some of like the common things that people kind of describe. Oftentimes, it just feels like you can't have that brain to body connection as well with the core. So it's like you go to do the typical engagement and kind of go through the motions the way you did before. And it's just not like clicking, like it's harder to feel that sensation in that area. So that's one really common experience. I'm missing the whole chat. Some people are sharing, I think. Okay, great. Kate shared that she had some pubic symphysis pain. We're definitely going to address that, because we're going to talk about how the pelvic floor and the pelvis are related to the core. Thank you for sharing that. 9 months postpartum and back to the weight, but feeling like the belly is looser. Yeah, and that's a common feeling too, just like this feeling of almost distendedness in the core, where everything is just stretched out and we've lost some of the tension that we used to have in those muscles. Oh, hey, Renee. Engaging the whole core is difficult, upper, lower side. Yeah, like differentiating the different parts of the core. We're going to talk about that too, for sure. Oh, interesting. Yeah, that's really interesting. Plantar fasciitis affecting the lower back. That's really relevant because the fascia throughout our body connects everything. So you could be having an issue with your core and then you feel it in your feet, or an issue with your feet and you feel it up higher in your hips or your shoulders. So this is all connected. And one of the techniques we're going to learn today is actually really helpful with like any type of experience you're having. So that's really good too. Pelvis off kilter, difficulty engaging pelvic floor and Kegels. Yep. Yeah. It's really common when you do return to things like running to feel these things more pronounced. So sometimes it's like you can get away with not addressing it for a while, and then you go to do something you haven't done in a while, like running or something, and you're like, oh, yes, that is not normal. So it's good. Sometimes it just takes a little while for us to see what's changed, but then that's good information for us to kind of slow down, pull back, or address it. Postpartum leaking is very common, and we say common but not normal, meaning it happens to so many people, but we don't want it to be happening, and there are things we can do to address that. Incontinence despite a lot of Kegels. We're going to address why you might be still experiencing incontinence despite a lot of Kegels. And pelvic floor PT. This will hopefully help with that. More lower back and pelvic pain compensating. Great. This is awesome. Thank you guys so much for sharing because I think it's really cool to see that. Well, it's not cool, but I find it very interesting. Everybody's experience is totally different, right? Somebody's experiencing the dysfunction in their pelvic floor. Other people are feeling back pain, pelvic pain, pubic symphysis. There's many different ways that some of these issues can manifest, but a lot of it comes down to the same thing, which is what we're going to talk about today, which has a lot to do with pressure, not to give it away. But yeah, I think everything we're going to talk about today will help with all these issues. And then I'll do one more check-in at the end, a little Q&A in case we haven't addressed any of your questions, and then we'll kind of go from there. All right, let's do it. Let me just hide the chat. Okay, perfect. Feel free to write questions into the chat as we go. I'm going to try to keep moving so we can get to the movement, but I'll definitely address them at the end. Okay, so we're going to start with a little bit of anatomy because one thing that's always surprising to me is how many of us go through pregnancy and postpartum without fully understanding the anatomy that's being affected. And of course, I think if I asked you, you would tell me what area of the body is most affected by pregnancy and most changed. Oftentimes it is that belly area, which is going to be the core, right? So I think we all feel that when we're going through pregnancy, but I think what we don't realize is the core is a lot more than just these ab muscles in front. So this is the abdominal canister, and it really is a whole system of different muscles and components that make up the canister of your torso. And that word is important because I really think it's helpful to think of it in that like three-dimensional sense. So just to go over what that means. Now, the canister is also referred to as the deep core. So when we talk about learning to engage our deep core, which we're going to do today, it's the same thing. We're learning to engage and coordinate our abdominal canister. So beyond just the core muscles in front, which we're going to talk today about the transverse abdominis, which is this big, long, corset-like muscle that covers a lot of area in the front. We also have our low back muscles, or the multifidi. And those are like kind of small muscles that tend to feel oftentimes really crunchy and like overstressed. We're going to talk about why that is. And then we have the top, which is our diaphragm, which is really heavily involved in breathing. It's a parachute shaped muscle. So it's shaped like a dome, and it contracts in a really interesting way. When we inhale, it actually contracts and presses downward. And when we exhale, it actually lifts up. So we'll talk about what that feels like in the body too. And then lastly, the pelvic floor, which is that like bowl of muscles in the base of the pelvis that has many functions. It really supports the organs inside, like the uterus. And when you have the baby in there, really working to support the weight of the uterus and baby. It stabilizes the body, like the spine, the pelvis, any of your balance work or control comes from that pelvic floor. And it also is in charge of things like urinary and rectal continence. So if you're having any issues with incontinence, then it is likely directly related to the pelvic floor. And then the last function of the pelvic floor is also sexual function. So an important one to note because sexual dysfunction could be another indication that something's going on there. Okay, so that's what it looks like. Basic, all you need to know is these four parts. You have the diaphragm, the pelvic floor, the deep core in front, transverse abdominis, and the back muscles that make up those fronts and sides. Okay, keep going now. Like I said, the function is controlling and stabilizing, but another function that I want to talk about is managing pressure. So here is where we're getting to something that might be a little bit of a newer concept, but pressure is actually what's behind a lot of the symptoms you guys were just describing that you're feeling. So basically, like I said, if you picture the core like a canister, it's really a container. And if you think about what happens when we breathe and we take air into that container, when we inhale, we're filling that container with air, making it a high pressure situation. And when we exhale, we're emptying that container and making it a low pressure situation. So it really is this whole pressure system that responds to every breath. You can see in my cool little graphic here, the pelvic floor and the diaphragm actually respond together to every breath. You can see the belly responding too. So when you inhale, it goes down, and when you exhale, it comes up, and that helps you manage the pressure. Now, if we have something that's kind of blocking any part of that system, it could be that your diaphragm is stuck and won't stretch. It could be that your belly is being pushed out and not engaged properly. Or oftentimes what a lot of the problems come from is tightness in the pelvic floor. And so when our diaphragm goes to push that air down, Instead of a responsive pelvic floor, it's getting met with resistance. And that is what causes, things like diastasis, where the abs split, or things where you feel that heaviness, or it causes leaking. So it's kind of a complicated concept, but all you really need to know is that if one part of this system isn't working, it will manifest. You will see issues in one area or another. Okay, so it can be a lot of different complicated ways that it connects and manifests, but all I want you to know is that the core is managing that pressure every day, all day, with every breath you take. And it's really important that our muscles are trained to adapt to different loads, different forces, different breath patterns, so that we have a nice, strong, responsive system. And one other thing I want to mention is, like I said, it is about like how much mass is in that canister. Think about what adds a lot of mass to that area, right? Pregnancy and your growing baby. So that's why it's so important during pregnancy and then also postpartum. Normally, you already have to do a lot to manage the pressure in the core, but when the baby inside is growing, 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 you guys probably felt this if you're postpartum. You remember what it feels like. It's like everything's pushing out at the edges, high pressure inside, and then you start to feel that pressure show up in different places, whether it's pulling apart at the pubic symphysis, heaviness in the pelvic floor, splitting in the abs. All of it is going to come out somehow. So that's why it really becomes relevant during this time. And I think the other thing that's important to note is part of the problem is when we try to go back to typical abdominal workouts, a lot of the movements, classes, exercises that you're seeing are just completely ignoring this system. Like, I'm sure for a lot of you, that was the first time you learned about that canister, right? And that the diaphragm and the pelvic floor and the whole deep core affect it. A lot of times, if you think about your abs, you picture what I'm showing in this image here, which are your six-pack abs or your rectus abdominis muscles. And when you're doing things like a million crunches and you feel that burn in the core, that's what you're addressing, is the six-pack muscles. But honestly, those guys are not super important for function, and they really aren't going to be helpful for healing postpartum. So if you kind of just have your baby, push baby out, and then when you get back to exercising, you're going right back to an exercise class where you're doing a lot of crunches, a lot of long planks, and you're not thinking about your form, thinking about your breathing and that pressure, that's when we start to see a lot of these problems, because the pressure has to go somewhere, right? And it's not being managed because we're just not training those muscles. Okay, so let's talk about just a couple of the ways that it manifests, and then we're going to talk about how to manage. Okay, hopefully I'm not going too fast. I tend to just get on a tangent with this. I love this stuff. Okay, so this is a buzzword, a hot topic you've probably heard of, diastasis recti. And this is something I see people come to me all the time. They're very concerned. What are my abs going to do? Are my abs going to split during pregnancy? How will I ever get them back? And honestly, a lot of times what we're hearing about diastasis can be a little bit of fear mongering, because the truth is, if you look at like the middle picture there, that split where you have like 3-4 fingers of width along that tissue in the center of the core, that happens to 100% of you when you are about to give birth. So by the end of that third trimester, when you're about to give birth, everybody has that stretching, because think about it, the stretching has to occur somewhere, right? And what we have in the center there, that like white part, is the linea alba, which is connective tissue. And so the tissue stretches better than the muscles. So the muscles tend to just move to the side, the tissue stretches. Now, after you give birth, the difference of some people having a diastasis and some people not is that for some women, it just pops right back. Yay, you're lucky it happened. Or if you manage your pressure well and your core was nice and strong, then sometimes it might come back a little easier. No guarantees, but sometimes. And then sometimes you can do everything right and it just doesn't really snap back in the same way. Tons of different factors to that. Could be the shape of your belly, could be if you had to push really hard or for a really long time, or if you haven't done any core work in a long time. It depends on like the elasticity of your tissue. So there's no predicting whether or not you'll have diastasis, but it is more likely to happen if you're not managing that pressure. Because again, if you picture that system that's like too rigid and the core is getting like more and more pressure inside as the baby grows, it's like it's busting at the seams. It's got to go somewhere. So it kind of gets that stretch instead of a responsive system that can breathe and can also offer support. I think that's all I want to say about that. Okay. Again, if you have questions as we go, feel free to put them in the chat and I'll hit them after. Pelvic organ prolapse is another thing you may have heard about. I'm surprised nobody mentioned it because it's really common. I think it's like 1 in 3 people have it. But oftentimes it happens to various degrees, meaning that you could have just a small prolapse and not even really know. But this is when you kind of feel like a lot of heaviness in that pelvic floor. Some people will feel a little bit of heaviness and that's normal. But for some people, it's like, I feel like my organs are going to fall out. Oftentimes, if you have that feeling, then I would recommend getting checked out right away by either your provider or just going straight to a pelvic floor PT if you're able to, because then they can confirm it. But the treatment for prolapse is a lot of the stuff we're going to work on today, which is learning how to manage that pressure. So we don't have so much pressure in our belly that's pushing down and out and causing that dysfunction. Yeah, I don't think any of you sounded like you had it, but just in case this is helpful to explain, if you look at this image here, this is the uterus kind of dropping into the vaginal canal. This is the bladder kind of dropping down, and this is the rectum kind of dropping down. So it can happen with any of those organs, and it can have to do with a weakness or just like too much stress on the pelvic floor. Okay. And then lastly, those are two really big issues that we hear about, we look for, and we're tracking. But then there's also all these little kind of symptoms, like some of the things you guys have described, urinary incontinence, lower back pain, pelvic pain, whether it's pubic symphysis pain, SI joint pain, pain with sex, difficulty regaining core strength. And one other one I wanted to mention is like bulging or coning in the core. So when you're doing abdominal work or using the core, you see like a protrusion along the center. That's also really common. So all of these things are what we would call common but not normal, meaning that they're signs that we're not managing the pressure in the core well. Okay. So what's the best way to prioritize the muscles in the abdominal canister? Meaning, how can we activate those deep core muscles rather than just going straight to those superficial abs that aren't as helpful? And how can we restore tension in that core postpartum? Meaning, we're able to manage that pressure better. It all comes down to one exercise and one really like basic technique that you guys need to know. And you may have already figured it out by now. Usually I make you guess, but I'm just going to tell you. It's a breathing technique because that is the type of exercise that incorporates the whole canister, all that good stuff. So it is called umbrella breathing or 360-degree breathing. Feel free to just say in the chat, like, yes, if you've heard of it before. I'm kind of just curious how many people have been told about either 360-degree breathing or umbrella breathing, or you may have heard it called diaphragmatic breathing. But basically, this is where instead of just taking a breath kind of willy-nilly, not focusing on how exactly we're doing it, we are using all of those muscles and the pelvic floor and the diaphragm and everything's in a nice coordinated motion. A few of you sound like you have. Oh, a singer. Yes. Amazing. Nice. Yeah. And it's good because it is one of those things where we are hearing about it, but a lot of times we're not actually learning how to break it down and apply it to our body, right? So that's what I'm going to teach you guys today. And then we're going to put it into a little bit of core work so that you really like feel it, learn it, and can take it with you. So yeah, it's going to be fun. I'm going to start describing how to do this breath, and then we're going to get into it. You can be seated for this part. So if you're in a chair, you can stay seated in the chair, or if you want to make your way down to the mat, you can. But let's talk about it. So 360-degree breathing or umbrella breathing is described this way because the rib cage and the diaphragm are expanding 360 degrees when we take an inhale. Why is that important to note, or why is that different? For a lot of people, like if you were just sitting and I told you to just take an inhale, a lot of people would go and their shoulders would lift and it would go right up into their chest, and their rib cage, the belly, the pelvic floor would not react at all. In this movement, we're going to expand the bottom of the rib cage, and it's going to look like an umbrella opening, as if your sternum was the tip, and all sides of the ribs are going to go out in every direction. So let's just try to feel that. We'll build the breath slowly and kind of learn it. It's a little bit of like a lot to think about, but just starting with the rib cage, if you put your hands on your ribs, fingertips in front, thumbs in back, can you breathe into all directions there? So taking a nice big inhale into those hands, and see, for a lot of us, it's easy to expand forward, right? most of us do because our ribs naturally flare during pregnancy anyways. But what can be hard is expanding side, and then especially hard for me too, is breathing into those thumbs in the back and actually feeling the back expand. So without lifting the chest, try to stay nice and neutral. Just take a couple more on your own and see if you can get those ribs moving out to the sides, into the thumbs and back. Yeah. And look, if you have never done this, or if you're having tension anywhere else, this is not necessarily easy. Like, you might not be able to master it today. Sometimes we have to do a lot of work on mobilizing the ribs and getting things moving and stretched and opening things up so that we can access that. But it's good to know your starting point. Am I able to expand there? Not so much. That's okay. Just take that as information. Next, I already told you it incorporates everything. You saw this little diagram to show that, but just to explain one more time how the diaphragm and pelvic floor react. I sometimes say, if you want to do these hand gestures with me, it might feel ridiculous, but no one's looking at you. And it helps you picture what's going on. Because again, when you think inhale, most of us think up, right? But that's the opposite of what's actually happening with our diaphragm and pelvic floor. When we actually take a breath, as you can see in that diagram, you're going to inhale and the diaphragm is going to push down and the pelvic floor is going to yield down and like spread and release. So see if you can just feel that, because sometimes it's hard to find the release in the pelvic floor. And this is the part that's missing from a traditional Kegel exercise. So this is why you could be doing Kegel after Kegel after Kegel, but not actually strengthening the pelvic floor, because you're never relaxing that muscle. So we're going to try to find the relaxation in the inhale. So find whatever you're sitting on, your sit bones there. And I like to just use a lot of imagery. Like, I imagine like I'm filling a balloon in my pelvis. I feel the bones expanding, and you feel a little bit of stretch, a little bit of release, a little bit of kind of yielding, or just kind of spreading, I sometimes say. It's hard because you can't see it. And even if I was looking at you, I wouldn't be able to know if you're relaxing your pelvic floor. It's something that you kind of have to feel. So it can be hard when it's new. But that is why, for a lot of us, if we're only ever contracting our pelvic floor, then it's like doing a bicep curl, and this is the only range of motion that you do. Your bicep's not going to get very strong, right? We need to fully release in order to fully engage and be able to build that range of motion, that strength, that versatility. Because if we're only strengthening here, that's not going to be a very functional muscle, right? So that's what's going on with our inhale. And I'm going to break it down in our bodies in just a sec. I just want to finish these notes. I already said this: down on the inhale, up on the exhale. So just like I said, down on the inhale, what's happening on the exhale, pelvic floor is going to lift up and kind of tent up and in. And then the diaphragm is going to kind of return to that domed shape. So for the diaphragm, it contracts down by spreading and lifting. For the diaphragm, I describe it like a parachute. If you guys ever did like parachute in gym class, where everybody grabs the sides and you all run in and lift it up, and then you all run back and stretch it out. When we are inhaling, it's like we're stretching it out, running to the sides, pulling taut. And then when we exhale, it's contracting up and in. This might seem like a little too much information, but the more you visualize this, what's going on in the body, the better engagement and the better contractions you're going to get as we do the breath and go into the core. And then last thing I'm going to say here is that with that pelvic floor, same thing, but the kind of the opposite. It's like spreading down and out, and then it's lifting, and I like to say kind of tenting or pulling up and in, which also is a little bit different from a traditional Kegel, because for a traditional Kegel, I think that a lot of times it ends up being this like squeeze tight, like sphincter, squeeze as hard as you can. And then they're just like, okay, now do it again, and now do it again. And so again, it's a limited range of motion. It's too tight, too much. For this, I want you to think, instead of a tight squeeze, just a feeling of lift. And just a couple images, like if you ever see those slow motion videos of like a flower opening and closing, they show like in daylight and nighttime. That's what I picture here. So when it's opening, that's the inhale. And then when it's closing, that's the exhale. And then, yeah, you can also picture like picking up a blueberry with your pelvic floor or something. People like that one. Okay, so let's try to kind of put it into our bodies. If you haven't yet, I'm going to stop giving so many details and kind of walk you through how to coordinate it. And then I'm going to get ready to just jump into a little bit of movement. I'm going to let you watch this because it's a little clearer video than like watching me right now. but you can see on the inhale, I'm kind of indicating with my hand what the pelvic floor is doing. And then when you watch this side view, you can see my belly relax on the inhale. And then on the exhale, lift, 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 and kind of hug in. Okay? All right. So find a nice place to sit, stand. I'm sitting on a block. If you feel comfortable seated on the floor, that's fine. But I just want to make sure we're not slouched or tucked under. We're nice and tall. Okay. So I've broken it down into easy parts. For the inhale, you have 3 things to think about. And when you do the exhale, you have 3 things to think about as well. So for the inhale, we're thinking ribs, belly, pelvic floor. That's the sequencing. So we start with that expansion of the rib cage we just learned. We inhale into the hands. We fill the belly, sides, and back, let those release and expand. And then we let that pelvic floor release at the end. So that's the inhale. We're just gonna work on the inhale for now. So first the ribs, try it in your body, then the belly, sides, and back, then the pelvic floor. We oftentimes have more air than we think we do, or more lung capacity, I should say. So if it's feeling hard to take a big, deep breath, another trick is doing like little sips of breath. So you can go like in, keep filling. You might find a little bit more space. And then one other image that helps with this one, I picture like filling up a pool float. If you ever fill up a pool float, sometimes like you think you're done, but there's like one compartment and then you have to do another compartment and then another compartment. That's what this is like. We fill the first compartment, which is the ribs, second compartment, belly, sides, and back, third compartment, pelvis and pelvic floor. All right, so that's the inhale, top to bottom. Now let's build the exhale. Exhale starts bottom, pelvic floor tenting up and in, like we just talked about, that lift and that kind of gentle lift, not a tight, tight squeeze. That's first. Next, kind of like I showed in the video, the belly lifting from the bottom up. I'll close the presentation in a second so you can see me better. And then the ribs dropping down at the end. Okay? Here, let me close this so you guys can see my body. Now we're gonna put it into a little more movement. So those are the 3 parts. I don't know how to see myself. Whatever, that's okay. So, trying it there. 3 parts, top, middle, bottom on the inhale, bottom, middle, top on the exhale. You can try it with me, or if you wanna go on your own timing, that's fine. So, inhale into the ribs, into the belly, sides and back, into the pelvic floor, then exhale, bottom to top, pelvic floor, low, middle, high. Good. If that's not coming naturally to you, or if it feels like, oh my God, I don't know what's going on, trust the process, stay with it. Sometimes, like I was saying before, you can lose some of that sensation in the core postpartum. So you might be doing it, but you can't feel it. Or you might be like starting to rebuild that connection, but it's not 100% there yet. Repetition is going to be your friend. It's going to help you continue. Okay. So while we do this, try to lay on your back for the next part. We're going to use the breath like we just did, and then we're going to build into a little bit of core exercises so that you can see what it looks like to put it into practice. So find a spot where you can lay down, or you can just watch if you don't have room to lay down right now. No need to leave. We're just going to do this for a minute. So finding a nice neutral spine, trying not to let your pubic bone be too high or too low. We find nice neutral. Sometimes it's a little easier in this position because it is actually easier to relax the pelvic floor when you're flat on your back. So let's try it here. Same pattern. First we do the ribs, then the belly, then the base of the pelvis. On the exhale, we lift pelvic floor, low belly, middle, and then we drop those ribs. That's it. Inhale, top to bottom. Exhale, bottom to top. Try a couple on your own. I'm just going to keep talking. I haven't stopped talking. But the reason that this is so essential, and I think really a unique way to do it, is a lot of times when we're doing core work, we just jump right in. We're just going for whatever we're doing, and we're kind of moving through the motions. Now, if you picture that pressure system again, when we're full of air, we're kind of expanded and pushing out, right? So if we're doing strengthening work in that position, then we're strengthening the core in an expanded state, which we're already expanded for pregnancy, right? What we want to do now is shorten and restore tension and kind of hug back in. So it's so important to fully exhale every time so that the core is in its smallest, most tense position when we engage. Does that make sense? Hopefully. So the point is just the exhale is your best friend, and you want to let as much air go with every exhale as we can. Okay, so try that out. Let's bring the legs to tabletop. And you've probably all seen dead bugs. We're just going to do just the legs or heel taps here. And if you just go to do it without any cueing, you're probably not going to feel a ton, right? And even if you just think, exhale as you go, you might feel a little more, right? Now, we're going to break down how we do this, slow it down, and add in everything we just learned and see if we can feel a little more. So, starting with the legs in tabletop, go super slow, try to stay with me. We're going to start with our inhale into the ribs, into the belly, into the pelvic floor. And then on the exhale, you're going to lift and engage, and then go for your tap. So don't do that heel tap until you've done almost your full exhale. Really give the exhale a head start. Try the other side. Big inhale, ribs, belly, pelvic floor. Bottom to top. Then go for the exhale. Already, hopefully, you're feeling a lot more connection and deep core engagement. Try a couple more. Really see, I say it's like wringing out a sponge. You want to see how much you can eke out of every exhale. And I'm just going to keep talking, so feel free to go on your own timing now. Big inhale, big exhale, empty, 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 and lower. And just a quick reminder, the reason we are doing this work is to stabilize the spine, meaning we're trying to avoid this. If you look at me, the pelvis rocking and the shoulders and the ribs peeling off the mat. So everything is about stabilizing that core. So when we move, we keep it stable. Good. Let's add on from there just so you can feel how to kind of increase the challenge. Let's bring our hands up to the ceiling. We're going to reach our arms back to a high diagonal as we do the heel tap. So both arms, one leg. Here we go. Inhale. Exhale, engage. Then go for the movement. Notice how long I wait before I move. Inhale. Exhale, engage. Lower and tap. Good. Couple more like that. Inhale. Exhale. Belly to spine, pelvic floor lifts. Still try to find the same sequencing. Inhale. Exhale. Lower and tap. Nice, guys. Try a couple more. Just feel it out in your body. See what you notice. Maybe one more. And then I'm just going to show you my other favorite exercise for really finding that feeling of the deep core. Usually I didn't mention yet. If you feel like, I'm not sure if I'm engaging my deep core, one thing to know is the deep core is a very thin muscle, like the transverse abdominis, the lower back, everything are very thin muscles. Whereas like those six-pack muscles, if you do a million crunches, you're going to feel that burn. Not so with the deep core because it is a different type of muscle. So even if you are engaging fully, it's not going to feel that same like burn that you're used to, which is why people often bypass it, right? Because they're looking for that burn. But try this exercise with me. You might feel a little more engagement, a little bit of shakes, a little bit more activation. We're going to bring one knee in. Let's bring our right knee in, and we're going to put the right hand to the back of the knee on top of the thigh. And we're going to add pressure on that side. So we're going to push into the hand and pull the knee into the hand to add pressure to the end of the exercise. So important to sequence properly. We inhale first. We exhale, empty and lift. And then as we finish the exhale, we push, pull, push, pull, push, pull. Okay, a couple more like that. Inhale, fill it up. Relax pelvic floor. Feel all those same steps. Exhale, bottom to top. Push, pull, push, pull, push, pull. Hopefully that you feel that deep core start to tighten and firm. If you use your hands, you can feel that deep core activation. You want to feel more tension rather than squishy. Try the other side, same thing. Big inhale, big exhale. Lift, lift, lift. Push, push, push. Feel that tension. One more, big inhale. Exhale, engage. Push, push, push. Good. Oh, I have so much to share, but I'm trying to stay mindful of time. I just want to show you one more thing. You can add that push if that was really working for you. Add it to your heel taps. This is my favorite way to do heel taps. So you put your hands to the back of the knees. We're going to do the same heel tap as before. And the leg that's staying in tabletop, we're going to add that pressure like we just did. So we go inhale, exhale, engage, add the pressure, tap the other heel. You can do one hand or both hands. Other side, inhale, exhale, engage, add the pressure, tap the heel. Good. Feel free to keep going, guys. This is kind of more like experimenting on your own body. Everybody's different. See what you need. What's more important to me than you getting a good workout today is you learning how to apply this to every workout you do going forward. So just play with it. I'm going to take questions in just a second. I want to share one more thing. I'm not trying to say that you can never do crunches again or that they're totally useless, just eliminate them. They're just not the most helpful thing early postpartum when we're trying to heal that core. And if you picture those superficial abs, they're floating on top. If our core underneath is weak, then it's not really beneficial, right? But once you've done that strengthening work and you've started to really rebuild that base, then it will be time eventually to add those upper abs back in. But again, it matters how you do it. So if you're just pumping and going for those crunches without doing the breath, we're doing the same thing. We're strengthening in an extended position instead of engaged. But you can build onto it from the exhale that we just worked on. So I always cue crunches like this. Inhale, top to bottom. Exhale, bottom to top. As the breath gets up to the ribs, that's when you add the crunch. And if you want to try it, you totally can. It is safe to do, and you do it this way. Inhale, top to bottom. Exhale, bottom to top, and lift. And that's it. So you might feel even more activation. You're actually going to kind of bias the deep core first and then add the upper abs on top. And it's going to be a much safer way to do it. If you are someone who sees that coning or doming, it will likely reduce that for you. And it's going to just be a more kind of functional, effective way to reintroduce those upper abs. Lastly, I'll just say, because people always ask me, can I do planking? Is that safe? Planking is similar to being on the back, right? We're using a straight spine. We're not doing that curved crunching. So it is actually a good thing, but it's just a lot of load. It's a little intense. So I always recommend just getting really strong in a kind of hands and knees plank first, working on the breath here. It looks totally different here, right? So I'm expanding the belly and then hugging back up and in. Once you get strong with that, then we can work back up to planking, but always just making sure we're not tucking or rounding, because then we're going to primarily use those upper abs. Okay, sorry, I always do this. I really just start throwing things out there, but there's so much to say about this. Feel free to come back to the computer because I do want to hear if you guys have any questions. I have a couple more minutes, so I'll stay. But parting thoughts, I just want to share this just so you guys know how to work with me, just in case anybody needs to go, because as great as this was, I tried to give you as much as you can. You know, just learning it once might not be enough. So I do one-on-one training in Manhattan and virtually. And then I also have a 10-week postpartum program that focuses a ton on this stuff, even more in depth. And I offer 50% off your first month for Auggie users. And so it's like a lot of work to continue. So it's okay if it didn't come 100% today. And I also want you guys to have my email if you want to ask me questions. But let me see. Kind of curious about what questions we have. I'm going to go back to Jessie first. Okay, if we want kids close in age and trying to get pregnant again soon, but externally surface abs, the core isn't back to our old self, will postpartum healing after the next baby be even harder? Do we stand a chance? Good question. I definitely heard people be like, what's the point of recovering when I know I'm going to get pregnant again? Getting strong before pregnancy is going to help you during pregnancy and after. So, but that doesn't mean you can't build strength during pregnancy. I think some people think we have to get to this certain point during pregnancy or before pregnancy, and then once I'm pregnant, it's over. I have to just accept where I'm at. Not true, especially for a lot of the first trimester. You don't really feel pregnant other than, of course, nausea and fatigue. But like physically, you're not seeing those changes. So you can continue to build strength then. And like I was kind of saying before, the more you do this work and this type of engagement during pregnancy, the more less work you're going to have to do postpartum, because it's still going to be there for you. So I would never recommend that someone just say like, just give up, you'll wait till you're done, because it's not about the aesthetics or that feeling that, oh, it's just not going to look the same. It's really about the strength that the core is offering, and having a strong core during pregnancy to support the belly, strong pelvic floor to support the belly, is going to help you so much. So if you want to have kids again soon, I would recommend doing this now, getting as strong as you can before you get pregnant, and then keep going. Don't stop throughout the pregnancy, because that will make a big difference too. Okay, perfect. I love these questions. Renee says, I feel like my mid-back is engaging to compensate for the ab weakness. Any advice? Yes. So a couple things to think about. First of all, a lot of times we think anytime we feel anything in our back, we're like, uh-oh, I'm feeling my back. But like we just discussed, the back is part of the core. So when we're doing this stuff, the back might be engaging. That might be okay. However, sometimes like, usually we can kind of tell, oh, it's not like the good kind of engaging. If that's the case, I would just be really cognizant about how connected you feel to the mat. I like to do this trick. If you feel like your ribs are peeling off, take your fingers, I don't know why I just did that, take your fingers and pin them under your bottom ribs, and then try to move from there without removing the fingers. It's such a good trick to feel the deep core because sometimes it's really hard to stop that little bit of peeling off. Take the fingers, squish them, keep the squish, and lower. Another trick, limit the range of motion. If you can't maintain when you go all the way to the bottom, don't go all the way to the bottom. Go until where you feel the peeling want to happen. Okay? It's genuinely oftentimes a strength thing. So as you build that strength, you'll have more freedom to get into those bigger ranges of motion again. But I recommend keeping it in a range that you can do without that compensation. Hope that's helpful. This is so fun. Okay, will this help with remaining sciatica issues? Yes, because sciatica oftentimes is, it's technically a lot of times related to the glutes, but the glutes are really closely connected to the pelvis and the pelvic floor. If our pelvis is super unstable and kind of like jiggly, which can happen because of pregnancy, then our pelvic floor has to work harder to stabilize it. But if it's not doing that, then the glutes grip. The glutes take over. So that's why a lot of times sciatica happens, is because the glutes are like, we need stability. But the pelvic floor and the core are really the ones who are supposed to be stabilizing. So the more you strengthen the pelvic floor and learn to release it, get that full range of motion, and the core, it kind of offloads the glutes so that you can use them more properly. So in combination with things like doing more range of motion, mobility, strength for the glutes, I think that this totally helps with sciatica because it relieves the glutes a lot and relieves the back. Okay, last question I see here. If you have any more questions, feel free to put them in before we go. I've just started taking Pilates and bar again. I'm understanding that it's safe to do the ab exercises in those classes as long as I'm incorporating the 360-degree breath. Yes. And might it help with lingering pubic symphysis pain? Yes. I would say yes to both of them. Like I said, my goal is for you guys to be able to take this with you and run with it in anything you do. So if you want to be doing upper abs again, all I want you to do is master this first and then get back to that. So if you feel like you're having a good understanding, you're able to make these motions happen in the body, then you can keep building. It's progressive, right? So you want to make sure you can get that deep engagement and then start to add on the more advanced moves in class. I would just be really diligent, monitoring yourself as you go, making sure you do still feel like you can control the breath, you can control the core with all the stuff you're doing in the class. And then, don't try to be a hero. If you feel like, okay, I had it, but now as we do this harder move, I'm losing it, go back to the move where you had it, right? Because we don't want to work in a negative pattern. So just kind of pay attention and try to progress slowly rather than going 0 to 100. Beep, beep, beep. Last, she was also asking if it'll help with pubic symphysis pain. Kind of same thing I was saying to Alyssa about the sciatica. That is often due to the pelvis kind of stretching and expanding. So this is going to help pull everything back together and give that nice stability from the muscles. So the more strong and secure you feel in the pelvic floor and deep core, the less likely you are to have that pubic symphysis pain. Okay, that's it, guys. Here, I just want to make sure you guys all have my website where you can get my contact info if any questions come up. And I do have some free videos on my platform, like all the videos about how to engage the pelvic floor, kind of like a review of everything we just went over, are all free on my platform. So feel free to check that out. And yeah, just keep doing the work. It's very, it doesn't happen overnight, but it's something you'll keep working on, and it's going to help you for years to come, future pregnancies, everything. Yay. Thank you, guys. I'm glad this was helpful. It was so nice to have so many of you. Awesome. Yeah, you can find me on Instagram too if you want to stay in touch. It's her_move_. Yeah, with pelvic PT, I love pelvic PT, but every PT situation is a little different. Sometimes they have different priorities. I'm more exercise focused, so I think it's a good thing to learn in combination with pelvic floor PT. So, All right, friends, feel free to reach out to me. I'll just put my email here too in case you need to start a conversation because everyone's so unique. So I love hearing from you. If you have any questions, I'm always happy to chat. All right. Thanks for being here, everybody. Good to see you all. Have a good day.